Hello, ladies and gentlemen, and welcome to a Mental Health Monday. And today, we are going to be talking about what to expect during your first therapy session. Yes, if you clicked on this video, that is what we are getting into today. Now, I know it's very bright in here. I can't control that. It's like the opposite of last video. Last video, it was like pitch black, and then now this video, it's like wow. I mean, just watch this. Just look how but yeah, we're gonna be going over exactly what you can expect and just kind of all the different things to, kind of prepare yourself a little bit. Because if you're someone who, kind of gets anxious thinking about, what's gonna happen and whatnot, I'm gonna pretty much just go over a couple of those things. Okay, so the first thing you can expect is basically when you walk in there, you're gonna probably sit down somewhere. They're gonna have like magazines or like toys or something to play with, and pretty much they'll ask for your name and stuff, information and all that, and then you're gonna sit down, go on your phone, do whatever, and then in like maybe 10-20 minutes, depending on how early you got there, they're gonna call you in the back, and pretty much they're gonna walk you over there, and then you're gonna sit down on like a chair or a couch, and just kind of stuff like that. But there are gonna be some questions that they're gonna ask you, and I just want to prepare you for those types of questions. Now, depending on what you're dealing with and depending on why you were there, their questions are gonna change. For example, if you are someone who's dealing with anxiety, they might ask you, what are some of the things that make you anxious? Or what are some of the things that you feel you can't do, and what's it preventing you from doing? And that's kind of the same for stuff like depression and whatnot, or whatever you're there for. They're gonna kind of change that question to whatever is related to you. They might ask you a little bit of in-depth questions, like they might ask you a couple different things about like your family life, your friend life, and kind of how this mental health problem has affected your way of living. And that's one of the questions that they asked me, was how has anxiety affected my life, and what are some of the things that I no longer can do. And I pretty much just went over that, and then they kind of like told me, what things do you want to be doing again? So one thing I would kind of come up with is maybe write down a couple things that you want to do in the future, just so you kind of have an idea of what you're going to say. Or maybe write down some things that it's affected in your life, just so you kind of know how that's going to work. They might even ask you why you are there. They know why you're there, but they kind of want to hear the way that you say it, just so they can kind of understand like the main issue. Like, let's say you've been like dealing with a lot of anxiety type stuff, but the first thing you say when you go in there is like, if they ask like, what brings you in today, and you say like, I just been going through some mental health stuff or mental health issues. Or you can say like, I've been dealing with some anxiety, or I've been dealing with some depression. And they kind of ask you that to kind of get a feel of like the main problem. If you just kind of say more of a broad thing, that usually means like that it's multiple different problems. And if you say something just like anxiety, then usually that means that anxiety is like the main issue. They might ask you a couple things about like the problems that it's caused, and they might really try to go deep with like everything that they ask you. Maybe not like the first time that they meet you, but I can definitely see some of them like, asking you some personal questions like, how has this affected like your relationship? Like, let's say you bring up you have like, I don't know, a girlfriend or something, and they kind of ask you like, how has this affected your relationship with her? And some of these questions can make you feel a little like, kind of anxious or maybe a little worked up, but that's what it's supposed to do. Because the whole thing about therapy and why people do it is because they want to get better. But you can't get better if you're just always in your comfort zone. You have to get out of that comfort zone, and that's what they kind of try to teach you by talking about certain things, especially if you're someone who's an open. I would say one of the biggest things that I kind of did when I was younger and like did a lot of therapy was I wasn't really open and I never like really had a panic attack or any sort of anxiety thing when I was in the therapy sessions. But then one day I ended up actually getting a panic attack and getting anxious because I just wasn't fully prepared, and I ended up having to leave early. And that's one of the things I want you guys to remember as well, is if you need to leave early or if you need a break from the whole thing, that's okay. I mean, you're literally facing like some of your biggest fears. You're talking about some of the things that you've gone through, and that can be kind of intense for some people. So if you need a break, literally just ask. They will be more than willing to let you like take a 5-minute break just to kind of relax a little bit, or maybe go outside for like 5 minutes to kind of like relax. And if it's ever way too much and you just feel like your anxiety is out of control, or you're starting to get this weird feeling, you can always go home and schedule another appointment. But I want you to remember that fighting through those feelings and emotions that you're gonna have during like the first and second time, those are normal things, and those are things that you kind of need to feel so you can understand the level of anxiety or the level of depression that you're kind of feeling. Sometimes they might you might be in the middle of like talking and stuff, and they might ask like, how are you feeling? Like, how are you feeling right now after telling me that? Now, if you're someone like me, when I heard that, I sometimes feel like, oh man, they can see that I'm like getting a little bit anxious, or they can see like that I'm not really talking as much as I should be. And sometimes it does kind of freak me out a little bit. But what I will say is they're asking that question to see how you respond. If you respond in a way of like showing like you start to get anxious, that tells them that when being confronted with like your emotions and stuff, it can make you a little bit anxious. A lot of the things they might also do is like give you a sheet that you can also bring home. This sheet, again, it really depends on what you're feeling. I'm just gonna base this all off anxiety just to kind of make it easier. So let's say you go in there for anxiety, right? And at the end of the session, they're gonna give you a piece of paper that pretty much is going to have like a list of things that you can try to do. And depending on what kind of, therapy places you're going to, it depends on the sheet of paper that they're going to give you. If you are someone who wants to do meditative type therapy, that is going to be something where they give you like a piece of paper of how you can do breathing techniques, how you can sort of meditate. And if you're someone who isn't really like that, or maybe you're taking a different one like exposure therapy. Exposure therapy is pretty much trying to convince you and get you to, face your fear like head on, I guess. Now, I'm not saying meditative like therapy is, not facing your fear head on, but think of it more like it's trying to teach you how to like be at peace and like trying to teach you how to be calm. While exposure therapy is like jumping right into the action, getting really anxious, and then seeing what happens. Now, I know to some people, one seems like really easy and the other one seems really extreme. But you kind of have to measure them both out. You kind of have to think, okay, why would I need exposure therapy compared to something like meditative therapy? There is a huge difference between them, and I would definitely say that exposure therapy is way more intense because that's actually you facing your fears head on and like just doing everything you can to make it where you can't like run away, right? Like you can't run from the situation and you can't like do any of that stuff. You have to just be there, be in the moment until you calm down. Now, exposure therapy on a level of 1 through 10 of how hard it is, it's like a 10 out of 10. It's super hard because every bone in your body is telling you that this isn't right, that you shouldn't do it, and that something bad is going to happen. That's what exposure therapy does. But the thing is that exposure therapy is the most effective therapy there is out there in the world. Like, I would arguably say it the most effective out there. Meditative therapy, I would definitely say, is for people who are kind of just starting to get anxious and like kind of just starting to have those anxiety feelings. Like, I would say if you've been experiencing anxiety and stuff for like maybe 2-3 months, like then maybe meditative therapy could help, because for some people meditative therapy is like really good. Like they love to like sort of meditate and kind of like be at peace with themselves. And meditative doesn't mean that that you just do like this, like that's not what that means. Okay, it means that you do certain things to kind of like calm the body down, like I said, with like the deep breathing, or maybe it's like using essential oils. That was one of the things that they kind of had me do a little bit, was essential oil type stuff. Pretty much what these are is this like type of oil thing that you can place pretty much anywhere on your body, I would say, but mostly like people do it in the hand. Okay, I don't really like this one. And then what you do is you just do this, you rub it on your hands, you do all that kind of stuff, and then you can smell it, and it smells like whatever kind of, I don't know, smell it has, right? And there's a ton of different options out there and a ton of different ways that you can use it. You can actually even like drink this stuff if you really wanted to. Not straight up, but like if you were to put maybe like 5 drops in your water or something, like you were just to put it in, those are a couple different things you can actually do with these. So they're actually kind of cool. That is one of the reasons why I actually have these Lava Breed bracelets. If you guys want to get them, they're on Flip the Mind right now. You guys can actually buy these. They're a pretty fair price, I would say, and they're actually homemade, so they're actually really cool. And what you can do with these is you can put the oil directly on here. And this is what a lot of people actually love doing. But this is a more of a subtle way to do it, and actually also add some fashion to it as well. You just put the oil on there like that, and then you just kind of like rub it around the whole thing. And then the whole thing will just smell like that for however long the oil, stays like that for. And then you put it on, and boom, now you have your own bracelet, but also it smells nice too. So wherever you go, whatever you do, it smells great. But anyways, that is a lot for like the meditative type stuff. But like I said, exposure therapy is definitely the hardest. If I haven't really gone into detail, I'll go into detail now. So pretty much, let's say you're someone who can't really get out of the house, right? Like you're someone who is kind of stuck at home, you can't really get out of the house, and you just kind of feel this overwhelming like feeling when you are more than your comfort zone away, right? So what they're gonna do is pretty much they're gonna not make you, but they're gonna instigate like, hey, what you should do is go outside of that comfort zone, stay in the car, and see how long you can stay there without needing to go back. Now, one of the things they're going to want you to do is they're going to be like, hey, I want you to stay here for as long as you can, as long as you possibly can, until you need to go home. And now most people, what they're going to do is if they start to feel really anxious or really panicky, they're going to be like, hey, drive home. But the whole point is you want to stay there as long as you possibly can. And, those are just some of the things that they're going to kind of show you and talk to you about for like your first therapy session, or maybe like your second one even. But I would just say the main thing you have to remember is that you are there because you want to like get help. And if you're there because you want to get help, then you really need to do the things that they ask you to do. If you skip out on the things that they want you to do, then that's not going to really work. And it's just not going to be great for you or your therapist, because, that it's just not going to be great overall. Because if you want to get better, you got to be willing to do whatever it takes to get better. But yeah, I would say those are some of the things that you can expect during your first therapy session. If you guys found today's video enjoyable, informational, whatever it may be, thank you. And also make sure you subscribe as well. We have gained a couple subscribers over the past couple of days, which I appreciate a lot. I've literally gained half my subscribers over the past couple of days. So thank you guys very much for that. We're going to keep uploading videos. Sorry about last video that I posted. For some reason, it like wouldn't let me post it. It took 2 hours. 2 hours to develop on YouTube. So I don't know. It's just kind of ridiculous. But anyways, I got the video up. It may have been like very, very early Saturday morning, but you know what? The video is up, so it's all good. But thank you guys for watching. Make sure you guys check out flipthemind.com right now. Join the Discord. Join all those different things. And I will see you guys later. Take care.